Well, the data comes from a very large database of many patients who were admitted to several hospitals in England, and from that we were able to identify which ones had non-alcoholic fatty liver disease, and then we split them up into those who had sort of simple fatty liver, those who had NASH, non-alcoholic steatohepatitis, and those who had fatty liver related cirrhosis, or we thought that was fatty liver related cirrhosis. And then we looked at what numbers of patients in those three groups had cardiovascular disease, so in particular heart failure, atrial fibrillation, and other associated conditions like type 2 diabetes and chronic kidney disease. And essentially we saw that the further you went down the spectrum of NAFLD, the increasing prevalence of these conditions we found. And also there was an increasing mortality. This is a cohort coming from what's known as the ACALM study group, which is headed by Dr. Rahul Potluri, who's a cardiologist. And it's his database, which is of nearly 1 million patients at the moment. So I helped him in doing this project where we focused just on fatty liver disease. There are very few children in this database, really. In the future I hope to do other research involving pediatric fatty liver disease, but focus was on adults. We know that patients who are affected with fatty liver disease are at higher risk of cardiovascular conditions. Cardiac disease is the main cause of death. It's a more common cause of death even in fatty liver disease. Broadly, for sort of two reasons. The same things that drive fatty liver also drive heart disease, so things like obesity, diabetes, high blood pressure. And then also certain factors about having advanced fatty liver disease is thought to exacerbate cardiac disease as well. It's always been known that cardiac disease is the main cause of death in NAFLD. Unfortunately, our data doesn't actually prove what the cause of death was. Probably the main things that we found was there was quite a striking mortality figure of that cryptogenic cirrhosis, that NASH cirrhosis group. There was over 50% mortality across a 14-year period. So that was quite a striking figure that I think will probably stick in a lot of people's minds. And I suppose the main novel thing is that this has never been done from a UK population. So there's several very big studies from the US where they've looked at a similar thing. Now, there are similarities obviously between the UK and the US populations, but there's ethnic differences, there's cultural differences. So it's important that there is some research from the UK that describes the prevalence of these cardiovascular comorbidities in the NAFLD population. With this particular project about the burden of cardiovascular disease in NAFLD, we're a bit of a crossroads because we are hoping to expand our current database, which has got 930,000 patients in, up to 5 million. So if we were to do that, then we'd have more reliable results because you'd have an increased population. So we can either wait for that, but that will take a while, or we're hoping to write up this piece of work and actually probably do some more advanced statistics to correct for a number of different variables. And I've had a number of interesting conversations this week which may show how we can possibly analyse our data better. Firstly, from a topic close to home, non-alcoholic fatty liver disease, that there are a number of emerging new treatments with exciting possibilities like GLP-1 agonists. The LEAN trial's got some exciting data. From a hepatitis C point of view, there's a number of sort of groundbreaking studies, and the main point I take away from that is that we're really at a point of nearly curing hepatitis C. Not quite, obviously, but the response rates now are unbelievable. And the final thing I'll take away is that actually diseases that were 20 years ago only just emerging, being described, and there's very little for relatively orphan diseases like PBC and PSC. There's now a huge emphasis on research, and the field is moving forward so quickly with extremely high quality development. I think that's where you're going to see a large number of developments and trials taking place over the next 5 to 10 years.